Good evening. It is really hard to believe and frankly hard to accept the people we need most right now in the face of this crisis, our healthcare workers, are most at risk because they're running out of the means to protect themselves. The disconnect between what we're being told about supplies on the way and what is actually happening in ERs is one of the many angles we're exploring tonight. As far as the numbers, no surprise, they're going up. And they will, say authorities, unless all Americans accept what's at stake and what we must do. We've got our team out covering it all, and Miguel Almaguer starts us off.
As the coronavirus crisis deepens and the U.S. government pleads for Americans to go home and stay home, scenes like these are unfolding in cities across the country. From canceled festivals to farmers markets and at beaches and basketball courts, many are ignoring the message to keep their social distance of at least 6 feet from one another.
I want America to understand this week it's going to get bad.
The Surgeon General, the nation's top doctor, says this is exactly how the virus spreads.
There are not enough people out there who are taking this seriously, and you just see it looking in California, people on the beaches. You see it in Washington, D.C., the people out looking at the cherry blossoms. We need to take this seriously.
With a growing list of governors in well over a dozen states now ordering residents to avoid leaving their house, more than 140 million Americans are joining the more than 1.5 billion people globally told to stay inside. The World Health Organization warning the pandemic is accelerating, with more than 300,000 cases recorded worldwide, the sick now in nearly every country.
I couldn't walk. I couldn't speak more than maybe 1 to 2 words.
Fiona Lowenstein, a 26-year-old New Yorker, is among the growing list of young Americans testing positive for the coronavirus.
Everyone was asking, okay, but are you autoimmune compromised? No, I am kind of the picture of health in many ways. And, I still got really hit by this very hard.
As communities big and small scramble to scrub and keep public spaces clean, even iconic landmarks like Yosemite are closed indefinitely. The National Guard is providing support in all 50 states. Officials are now worried cities like New Orleans and states like Florida and Texas will be next to be hard hit by the virus.
We don't have enough personal protection equipment. We don't have enough testing and collection equipment. We have the money for it, but the supplies are not available for us to be able to purchase.
With our nation in crisis, tonight more countries are calling for the Tokyo Olympics to be postponed. The International Olympic Committee considering that option, while more American athletes, like track and field star Eric Kennard, take a stand.
For athletes and fans to be safe, I think, a global pandemic is definitely grounds for postponement.
Tonight, a call for the world and the nation to come together, everyone doing their part by staying apart.
NBC News has confirmed for the first time in a 24-hour period, more than 100 Americans died from symptoms connected to the coronavirus. The death toll in the U.S. has now soared over 500. But, Lester, it's important to keep in mind the vast majority of Americans who get sick are not hospitalized and don't ever need to see a doctor. Lester?
All right, Miguel Almaguer starting us off tonight. Thanks. And now to the deeply disturbing warnings from medical workers as hospitals ration masks, gowns and goggles to their staffs. Some just days from running out and pleading for reinforcements. Here's NBC's Tom Costello.
With the COVID-19 pandemic crashing into emergency departments and ICUs nationwide, an urgent plea from frontline doctors, nurses, and EMTs running low on personal protective equipment, PPE. Seattle ICU nurse Bobby Habdas and her coworkers are now using just one mask all day.
I'm scared. My coworkers are scared. We're angry. We're terrified. At the risk of us being underprotected.
When she pleaded for help on Facebook, the community dropped off 2,000 masks at her front door. San Diego ICU nurse Shannon Cotton says her hospital has PPE now under lock and key.
As a nurse, if my patient's having an emergency, I need to be able to enter their room stat and help them. And it's really frustrating because sometimes you wonder, is there going to be an N95 mask there? Is there a face shield?
With 1,000 beds going into New York's Javits Center, the mayor is warning New York City hospitals will run out of basic equipment within 10 days. The governor says he's buying every mask and gown he can find worldwide, but he's imploring the federal government to take over the medical supply allocation for all states.
But this is not the way to do it. This is ad hoc. I'm competing with other states. I'm bidding up other states on the prices.
The Trump administration says it's sending pallets of gear to states in most need. But the American Hospital Association warns of dwindling supplies and says even with an infusion of supplies from the strategic stockpile, there will not be enough medical supplies.
We all know that eventually, no matter how much personal protective equipment we are wearing, with the volume of patients we're seeing in the ER, most of us in the healthcare workforce are going to get this.
Columbia University doctor Dara Cass sent her kids to stay with family before seeing her first COVID patient. Now she has tested positive.
It justified the fear that I had that I was going to be the person that was going to infect my family.
Tonight, major non-medical companies are stepping in to help. Apple and Facebook donating millions of masks. Hanes going from making underwear to surgical masks. Ford, GM, and Tesla say they'll start producing ventilators, though engineers warn an FDA-approved ventilator that pumps oxygen to the lungs while removing carbon dioxide is an extremely precise and complex piece of equipment with software and many moving parts. Meanwhile, another drug trial starts tomorrow, taking plasma from people who've had the virus, removing the antibodies, then injecting those antibodies into a sick patient, hoping to stimulate their immune system. Researchers believe it holds promise. Lester?
Let's hope all those supplies get to where they belong. All right, Tom Costello, thank you. And as Congress debates a massive stimulus package to stop the economic freefall, millions more workers are expected to file for unemployment benefits this week. Our Gabe Gutierrez is here in New York, where more businesses were forced to shut down today.
Turning his lights off and closing his doors last week was among the hardest things Dan Koch has ever done.
It's hard stuff. These are people that are depending on me to sell their merchandise, and we're going to be closed.
His store on New York's Upper West Side has been in his family for 4 generations. It's now among the many empty small businesses across the country in dire straits. As lawmakers debate the stimulus plan, what do you make of it?
I think it's very hard to figure out how this bill is going to trickle down to help people like myself.
Today, a lifeline. He learned his credit card company would postpone his next payment until next month, allowing him to keep paying his workers. But nationwide, unemployment claims are expected to soar this week into the millions. In just one day last week, New Jersey says a record 15,000 claims crashed the state's online system. Outside Seattle, Haley Berman just filed for unemployment for the first time after the dental practice where she worked was forced to close. She's 7 months pregnant, and her fiancé owns a small business.
I'm worried about our life together, what that's going to look like in the future for our child. And now, on top of everything, another concern is having to change my birth preferences.
The small fishing town of Barnegat Light, New Jersey is already taking a huge hit. When restaurants go dark, its livelihood dries up.
The seafood industry in this country, it's a big industry, it may need some attention. It'll need help. It'll need financial support.
There has never been such a sudden spike in unemployment claims, leaving cities, big and small, wondering what's next. Lester?
All right, Gabe, and this, of course, is why people are turning to their leaders, turning to Washington. So we want to go and look at that bitter fight on Capitol Hill. The Senate still deadlocked tonight as Americans and American businesses wait desperately for emergency funding. Peter Alexander now with the latest.
Tonight, senators still clashing over that massive relief package designed to rescue the paralyzed economy, including sending checks to millions of Americans. Senate Democrats again today blocking the nearly $2 trillion emergency bill, Republicans accusing them of trying to squeeze in items that are unrelated to the crisis.
They're filibustering hospital funding and more masks because they want to argue with the airlines over their carbon footprint.
The country is burning, and your side wants to play political games.
Democrats complaining the bill does too little for workers and too much for corporations. including a $425 billion Treasury Department fund, they say, without enough oversight.
The bill still includes something that most Americans don't want to see: large corporate bailouts with almost no strings attached.
Also tonight, questions about how one senator has responded to the virus. Rand Paul, a physician after testing positive, now under fire for meeting with Senate colleagues and using the Senate gym while awaiting his test results. Arizona's Kyrsten Sinema blasting it as irresponsible. Paul, who says he's shown no symptoms, insisting he went beyond current guidelines, saying it was my extra precaution that led me to get tested. And tonight, the president is hinting he might scale back those tight restrictions put in place to stop the spread of the virus after the CDC's 15-day guidelines expire.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months. We cannot let the cure be worse than the problem itself.
While health officials warn it'll take longer than 15 days to have an impact, administration officials tell us the president and his advisors are anxious to restart parts of the economy.